where we're going, though, is of some concern to me. When I was taught, when I was a medical student, we were expected to be extremely detailed with the work that we did. You know, we were told, you are a student. You are not here to work. You're here to learn. The residents, they are working. They're learning differently. You don't do what the residents do. You do what the students do. So they would give us a patient, and we would talk to that patient. And at the end of that discussion, we would sit down and we would write 10, 15-page write-ups on these patients. We wouldn't just, so how's your headache? Where does it hurt? Da, 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 da. No. We would have to really get details. Now, how does that impact medicine? I'll give you an example. I remember my wife was having chest pain. So she went to a colleague of mine, and he did what 90% of the doctors would have done. He did a bunch of tests. Boom, boom, boom. He looked at the tests and he said, oh, tests are fine, you're okay. She didn't buy that. So she was still having this discomfort. So her mother told her about this doctor, who I happened to find out later on was a pretty well-known cardiologist at Mount Sinai, the dean of cardiology, they would say. And he went to see her. She went to see him. When she got there, she went in to the consultation, and she spent a long time, probably close to an hour. At the end of towards the end of the visit, he called me in. I was in the waiting room, and he basically gave his conclusions. And then he said, everything is fine, don't worry. So she left, and her problem went away. Problem went away. He didn't do a test. He didn't do anything. He just reviewed what the other doctor had done. About a month later, I guess, since she wasn't referred, he didn't have anywhere to send a consultation report, so he sent it to me. I read that report. What this famous cardiologist did was a medical student write-up, the kind of write-ups I was used to seeing when I was in medical school, where you would basically study the person. The point is this: how can you tell me what's wrong with me if you don't know me? How can you know me if you didn't talk to me? How could you didn't spend any time with me. You just did a test. I don't care about that test. You know, this when the Affordable Care Act, so-called Obamacare, came in, you know, I was paying a lot of money for my health insurance. So I said, maybe I'll go on this exchange and I'll get some cheaper insurance. So I went on the exchange. I dropped my insurance, went on the exchange, couldn't get anything that was of any value to me. So I went back to my previous insurance company and I said, oh, okay, I want my insurance back. They said, oh, you can't get that anymore. We don't give that to you anymore because you're a small business. However, you can get this other one. So what I had before was sort of the equivalent of a platinum plan, so they gave me this gold plan. So this gold plan then required that in order for me to see a specialist, which I wanted to see, I would have to go and see a primary care physician first. So I'm saying, geez, why do I have to go see a primary care? Anyway, maybe it's a good thing. I need an exam. I need a good checkup. I need to make a relationship with a doctor. So, you know, my appointment was at 10 o'clock. I got there 9:30. They gave me some terrible forms. I filled out those forms. So I went in. The doctor shook my hand, and that was the closest I got to him. After that, he never came. I was dressed like this. I never loosened my tie. I was out there within, I went to see him at 10:05. At 10:17, I was on the street. 10:17. This doctor didn't touch me. He didn't put a stethoscope on me. At one point, he read the papers I filled out and he said, oh, so you'd like an HIV test? I said, well, as long as you're going to take my blood, I might as well do an HIV test. He says, oh, we don't need to do the blood. And I'm figuring, what? He doesn't know me. He didn't even take a history. How does he know if, I'm a primary care physician. Does he want to know what my cholesterol is? Doesn't he need to know my PSA? All right. So how has medicine changed? What are we teaching today? We're teaching students to sit in front of computers and order tests. We're not teaching them to sit in front of an individual and engage them. Before I order any test on you, I ought to know what the answer is likely to be. I need to know how to interpret that test. And guess what? If you don't trust me, whatever I tell you, you're not going to believe anyway. If I told you the test shows X and you need medicine Y, you won't take medicine Y if I don't know you. How would you know that I need medicine Y? So there is a relationship that needs to form between the healer and the individual who presents himself to be healed. And we talked earlier about my colleague Dr. Kokai. Mm-hmm. He spends time with his patients. He spends a lot of time with his patients. They trust him, and I hope my patients trust me because I spend time with them, mm-hmm. and I want to spend more time with them. I wish I could spend more time, but it's certainly not 10 minutes. Mm-hmm. It takes 10 minutes for me to say hello, and takes another 10 minutes for me to talk to you and find out what's going on. Takes another 10 minutes to examine you thoroughly, and it takes 10 minutes to come back in and talk to you and recap everything, and it takes another 10 minutes to get you out. If you add all those 10 minutes up, you're close to an hour, mm-hmm. and sometimes more. That's what it takes. Doctors don't spend that kind of time anymore. We don't teach the new doctors that they need to do that. So that's what's different within the last 10, 20,